Shoulder replacement is generally performed for conditions such as arthritis or trauma, particularly when conservative treatment has been tried and has failed. So for example, in arthritis of the shoulder, it's very common to try treatments such as injection, physiotherapy, or arthroscopic debridement. But if these fail and the patient remains in pain, then one might consider performing a shoulder replacement. There are a variety of forms of shoulder replacement available depending upon the nature of the condition. The commonest and simplest form is what's called a surface replacement of the shoulder, and as the name suggests, this involves removing the arthritic portion that affects the head of the humerus and replacing it with a metal component. In this operation, it's usual not to deal with the socket of the shoulder joint, the glenoid. It's a relatively simple operation. It is performed by an open technique, and patients will generally get over the operation relatively quickly, although it is only suitable for certain forms of arthritis. If both parts of the shoulder joint are involved, i.e. both the head and the socket, then it's common to perform a total shoulder replacement, which as the name suggests involves replacing both the socket side, the glenoid, and the head side, the humeral head, usually with implants that have a metal prosthesis on polyethylene, which is the commonest form of joint replacement. Again, rehabilitation following this can be fairly rapid, but it is usual to provide a fairly long period of exercises and physiotherapy before full improvement is seen, and this can take several months. In addition, sometimes what is called a reverse shoulder replacement is performed. What this means is that the geometry of the shoulder is reversed, so that the ball, which in a normal shoulder joint faces inwards towards the socket, is reversed so that the ball is on the inside, i.e. what was the socket side. The reason this is done is because it enables the shoulder to function without a rotator cuff. The rotator cuff is important in terms of movement of the shoulder, and therefore if the rotator cuff is damaged, and particularly if arthritis occurs as a result of rotator cuff damage, which is quite common, even a normal shoulder replacement will not restore movement. And so a reverse shoulder replacement is used as it allows movement to occur even without the rotator cuff. Again, the period of rehabilitation following this procedure can be quite long, and patients could expect to get movement up to shoulder level or sometimes slightly further, but the most important thing is that they maintain function and get rid of their pain. Like all replacement operations, there are complications associated with shoulder replacement, specifically infection, which is of course the most feared as it is an artificial implant. Whilst this will usually respond to antibiotic treatment, sometimes it's necessary to wash out the joint, or on occasions to remove the implant and then come back and replace it at some further time. In addition, particularly around the time of the operation, the implant may come out of joint, a so-called dislocation, and this will usually be reduced and held in place until such time as the soft tissues recover. Sometimes the implants will become loose, what's called early loosening, and if they do, then this particular part of the implant would need to be replaced. Thank you.